speaker is Himali Sudusinghe. She is the consultant dermatologist in Base Hospital Mayangana. She has a lot of publications and achievements on her account. She will speak on diet and skin. Over to you, Himali.
Thank you, Madam. Good morning, my dear teachers and colleagues. This is one of the important topics, but unfortunately has been addressed inadequately. Right, this is outline of my presentation. I will start with a brief introduction. We all know that nutrition is closely associated with skin health and is required for all biological processes of skin from youth to aging up to disease, right? And then nutrition level and eating habit can repair damaged skin and vice versa. They can cause a disease or damage to skin as well. So there are a number of different type of diets. I'm not going to discuss this in detail, but anyway, what is a DASH diet? Anyone knows? Yeah, it is a supplement of 4 to 5 servings of 4 to 5 vegetables, 4 to 5 fruits, and 2 to 3 dairy products per day. In this diet, less than 25% of dietary intake come from fat. Right. Few words about ketogenic diet in dermatology. The rationale behind is a beta-hydroxylate, a natural ketone body occurring in our body, reduces the activity of NLRP3 inflammasome that serves as an activating platform for interleukin-1 beta. So, using this, keto diet can be used as a therapeutic strategy in a number of dermatological conditions such as Behçet's disease, hidradenitis suppurativa, sunburn, hypogammaglobulinemia D with periodic fever syndrome, juvenile idiopathic arthritis, contact hypersensitivity, and diabetic-related skin diseases. Right. As everything, there are negative aspects of keto diet as well. This include systemic symptoms and laboratory abnormalities. Right. I will tell briefly and major in functional and biological aspect of nutrients. So starting with protein, and they form an important part of body tissues, including skin. Primary physiological functions are to construct and repair tissues, mediate physiological functions, and supply energy. Coming to lipid, they are closely related to skin epidermal barrier function, membrane structure, internal environment balance, and damage repair. But however, if we take high-fat diet, that can damage to skin, delay in healing, and damage to matrix remodeling. High-fat diet also promote skin inflammation and cancer, enhancing expression of inflammatory factors such as tumor necrosis factor by ultraviolet radiation. In general, the effect of high-fat diet is mainly to cause aging of the skin. So one of the important aspects is trace element. I will quickly go through zinc. The physiological functions of zinc in keratinocyte include wound healing, survival, anti-inflammatory effect, brought by impairing interferon gamma-induced upregulation of keratinocyte activation, ICAM1, and production of TNF-alpha, and also suppress the inducible nitric oxide generation and subsequent level in the blood. Right. So this is just to show you the foods that contain zinc. Right. Next, copper, important in extracellular matrix formation, synthesis and stabilization of skin protein, involving angiogenesis, and improve skin elasticity, reducing facial fine lines and wrinkles, promote wound healing, modulate melanin synthesis, and it also serves as antioxidant. The food containing copper. The next is selenium. That also protects the skin from ultraviolet radiation-induced oxidative stress. the selenium containing foods. Right. One of the important aspects is vitamins. I think Swarna madam discussed already the mechanisms of these things, so I'm not going to discuss in details, but vitamin A modulate proliferation of epidermal keratinocytes and dermal fibroblasts, and also prevent UV radiation-mediated skin damage, useful for the prevention and treatment of psoriasis, ichthyosis, skin cancer, and acne. So these are the foods that rich in vitamin A. And coming to vitamin B, sorry. It scavenges nitric oxides and reactive oxygen species and protect various cells from inflammatory oxidative stress. Vitamin B12 suppresses ROS-induced nuclear factor kappa B activation and related inflammatory cytokines. Vitamin B also suppresses phytohemagglutinin and concanavalin A induce production of various inflammatory cytokines. So the foods that contain vitamin B12 and B1. It's B1. So, sorry. Yes. Right. Vitamin C also, the major role is it acts as antioxidant and suppresses UV radiation triggered production of free radicals, protects in cells from oxidative stress and photocarcinogenesis, and attenuate UV radiation mediated damage in the skin and promote cutaneous wound healing, increases epidermal moisture content involving skin hydration. Foods that contain vitamin C. Right. Vitamin D, which involve in skin collagen synthesis and elimination of intracellular reactive oxygen species, and its effects as a key modulator of inflammation. It does down regulate monocyte macrophage derived inflammatory markers and dampens the differentiation, maturation, and antigen presentation by dendritic cells. Impair plasmacytoid dendritic cell mediated induction of T cell proliferation, inhibit proliferation of T cells, and reduce number of interleukin 17 and 22. So this we can use this because of this to treat psoriasis, and vitamin D act on keratinocytes to inhibit their proliferation and production of S100A7 and S100A15, which act as chemoattractant. Coming to vitamin E, suppresses lipid peroxidation, modulates photoaging and photocarcinogenesis. It also acts as anti-inflammatory roles, anti-inflammatory mediator, and has antioxidant activity. Foods rich in vitamin A. Right. There are research ongoing to find out effect of nutrient supplementation for improving skin conditions and to prevent skin aging. Right. So the second part, diet and dermatological diseases, which is important for us. Diet may influence the cause of skin disease. Example is acne. And diet may serve as one aspect of prevention. Example is skin cancer and aging. Dermatological diseases may be linked to systemic diseases. Best example is psoriasis. So in this condition also alteration of diet play a major role. And certain systemic medications prescribed for dermatological diseases such as steroid are known to cause systemic disease such as metabolic syndrome. So in this scenario also we can use dietary alterations. Right. Many dermatological conditions occur either due to deficiency or excess of particular nutrients. And some conditions are related to abnormal metabolism of these nutrients. So coming to psoriasis. Researchers shows that they frequently show unbalanced dietary habits. such as higher intake of fat, lower intake of fish or dietary products that may be related to the incidence and severity of psoriasis. So, and several trials of dietary changes for the alleviation of psoriasis has been conducted. This is just to show you the dietary factors which has positive and negative effect of incidence and severity of the psoriasis. So the negatives are saturated fatty acid, red meat, simple sugar and alcohol. The protective side, you can see polyunsaturated fatty acid, vitamin D, vitamin B12, dietary fiber. So, what is this? I can't remember. Selenium and probiotic. Right. This is one of the evidence using low-calorie diet. And you can see reduction of body weight and PASI score, improvement of PASI score with the intervention in the intervention group. However, this was combined with not only diet, combined with cyclosporine 2.5 milligram per kg and low-caloric diet. And there are reports to say that association of psoriasis and gluten-sensitive enteropathy. So, small trial has shown that improvement of PASI score with gluten-free diet, those who have gluten-sensitive enteropathy. So the recommended diet for psoriasis, diet rich in carotenoid, flavonoid, and vitamin C, which contain fresh fruits, which can easily available vegetable like tomatoes, broccoli, and sweet pepper, and diet rich in folic acid, and also diet rich in vitamin B12. Right. So, vitamin D suppresses hyperproliferation, as I mentioned earlier, in keratinocytes. So, it decreases the inflammation Th17 mediated cells and suppresses the expressions of interleukin 12, 23, and other inflammatory marker mediated inflammation in psoriasis. And also upregulate expression of late conified envelope protein, which usually reduced in psoriatic patients. So, let's skip this. Right. This also to show improvement of skin with dietary modifications among psoriatic patients has been conducted in 2017, and reducing alcohol, gluten, nightshades shows more than 50% improvement of the psoriatic skin lesions, and special diet like Pagano, vegan, and Paleolithic also shows a significant improvement of skin lesions. Add in fish oil, omega-3, and vegetables, vitamin D. Yeah, so done this. And this is very important. Low serum calcium and zinc during pregnancy, also known to precipitate pustular psoriasis. And so supplementation of these will be a helpful management in these situations. Right, coming to atopic dermatitis. Nutritional modification, following nutritional modifications we can use, but I will discuss very briefly some of these. So, probiotics. A meta-analysis concluded that treatment with probiotics significantly decreased the SCORAD index in children with atopic dermatitis more than 1 year of age. And these are the foods rich in probiotics. Prebiotics. Prebiotics are foods that contain a non-digestible ingredient that selectively stimulate growth and activity of non-pathogenic colonic bacteria. And one small random control trial did find that prebiotic alone lowered the SCORAD index in children with atopic dermatitis. So foods rich in. So next, hydrolyzed formula. That also has shown reduction of incidence of atopic dermatitis at the age of 1 year, which has been maintained till 3 and 6 year follow-up. However, from the available data, supplementation of vitamin D, E, fish oil, and evening primsol is not recommended in the management of atopic dermatitis. And these are the foods that commonly cause food allergy among patients with atopic dermatitis. Right. During the pregnancy, they say that elimination of highly allergenic food, including eggs, cow's milk, has conflicts in results. That means some studies says no difference of incidence of atopic dermatitis, and some says non-significant reduction of severity of atopic dermatitis. So we need further research to elaborate these areas. And increased ratio of omega-6 and 3 fatty acids is thought to be a possible contributor to increase in incidence of atopic dermatitis. This is for the mother. And then during lactation, exclusive breastfeeding is already known that is protective effect of incidence of atopic dermatitis. And coming to acne, it's another controversial area. And however, lower fat, high fiber diet can increase the level of sex hormone binding protein, thus lowering free level of circulating androgens. That means has positive, positive effect. And animal food and saturated fats tend to promote androgen release in the body and then should be avoided. So worsen the acne. And low glycemic load has been shown to be beneficial in patients with acne vulgaris. This is because the high glycemic foods that increase in insulin-like growth factor 1 and insulin-like growth factor binding protein and pemphigus vulgaris. Yeah. These are the list of fruits, vegetables, and other things that you should avoid it. But if you look at this list, there are nothing to eat for these patients. So I don't know, we have to conduct proper research before conclusion, coming to conclusion, right? It's very well known that dermatitis herpetiformis and gluten sensitivity, and the gluten-free diet reduces need for medication, resolution of in enteropathy, and protect from gut-associated lymphoma, reduce malabsorption. Should avoid gluten-containing food and recommended rice, corn, potato. However, those who are not responding to gluten-free diet, it's recommended that iodine-containing food also should be restricted or avoided. Right. Another bullous disease. There are no dietary factors has been implicated in the induction of bullous pemphigoid, and there are fewer evidence to say that gluten restriction in the presence of underlying gluten sensitivity to improve skin lesions in linear IgA bullous disease. And it's simple to understand that epidermolysis bullosa patients can have malnutrition, deficiency with mainly iron, zinc, calcium, selenium, vitamin A, C, B6, B12, and they have poor growth development. So we have to supply these and use fluid and laxatives to combat constipation. Coming to chronic urticaria, common triggers are shellfish, peanut, tree nut, and tomato. And what they say is pseudo-allergen-free diet is useful to control severe urticaria. And these are the evidence to support role of diet in hidradenitis suppurativa. 3 to 5 level. The elimination, you have to done dairy product and high glycemic load, wheat. And you can use vitamin D sinks. And level 5 evidence, elimination, paleo diet, nightshades, AIP diet, that is autoimmune protocol diet, alcohol, and caffeine. So you can use omega-3, Chinese herbal medicine, that's right. So the common foods that cause the allergic contact dermatitis, right. Coming to porphyria, antioxidant, iron chelators, and high-dose vitamin A is recommended. And generalized pruritus associated with renal failure can be alleviated by reduced dietary protein intake. And cholestatic pruritus is benefited by supplementation of polyunsaturated fatty acid. And for the vitiligo, excessively sour foods should be avoided. I couldn't find rationale behind these things, why they asked to reduce that. Any of these articles did not say because of this you should avoid this. That is what we need actually. Hair loss is mainly associated with iron deficiency and protein deficiency, so we can supply those in telogen effluvium, apart from that zinc and biotin. This is a, I don't know Indira madam knows the reason for this, and this article did not mention, and this first time I heard this, I saw this, no, that's why. Iodine has an aggravating effect in leprosy, and so they have asked to avoid seafood, spinach, cabbage, asparagus, carrot, garlic, onion. Again, there are no foods taken by these poor leprosy people. Right. Time is running out. So this is, I'm not going to discuss because we already know these things, deficiency disorders, cutaneous disorders, and excess causing disorders. And this picture shows the Mediterranean diet, which has no definite definition actually. And one of the important aspects is diet and cancer, so mainly antioxidant. Right. I think this part, most of the fact has been discussed by Swarna madam, so I will quickly go through. And two types of aging. We know that intrinsic and extrinsic aging. These are the molecular mechanisms of skin aging, and we direct preventive methods to combat these mechanisms. Just to show what is happening in normal condition and ultraviolet radiation induced skin. Right. Some of the eating habits contribute to skin aging, such as high-fat diet, I already mentioned, and high-sugar diet, and high-carbohydrate diet. So if you want to stay young, you have to avoid sugar, carbohydrate, and fats. And tobacco use, and alcohol use, which promote proliferation of keratinocyte and change in skin permeability, destroy the barrier function, and affect metabolism of triglyceride, cholesterol, and lipid composition of the skin. There are no limit to say this level is safe in the skin regarding. So certain advice is to avoid. In the management, I'm going to discuss only about antioxidant, which can be provided by diet, and retinoid, madam has already discussed, and diet restriction. Right, we will see foodborne antioxidant. One is collagen peptide. The role is they participate in the skin fibroblast as a precursor of collagen synthesis, and also remove reactive oxygen species from cells, protecting cells' endogenous oxidant defense system. Right. And these are the mechanisms promote collagen and hyaluronic acid synthesis, inhibit reduction of inflammation by regulating inflammatory markers, and prevent skin collagen degradation by inhibiting expression of proteases. So these are the foods that contain in collagen peptide photograph, and here also you can see. And then polyphenols as secondary metabolites of plant and exist widely in vegetable, fruits, tea, and other plant. And what they does is inhibit collagen degradation, increase collagen synthesis.
You have 2 more minutes.
Okay, madam. And inhibiting inflammation. So these are the polyphenol-rich foods. Right. And then polysaccharides, which enhance antioxidant activity, enzyme activity, remove ROS, and reduce oxidative damage. Regulate new expression of pathways that inhibit apoptosis. Right. Coming to vitamin, this picture shows the foods that rich in each vitamin, and each vitamin has different role preventing skin aging. I think this part already has been discussed, and what we only know is, want to know is foods that rich with vitamin A, vitamin B, vitamin C, which is powerful antioxidant, and vitamin D, which reduces DNA damage and inflammation and photocarcinogenesis, vitamin E coenzyme Q10, and fatty acid. Sorry. Coming to summary, diet can play a miraculous role in certain dermatological diseases, and it also plays a significant role in skin aging. Use of dietary alterations as therapeutic strategy still in infancy level and warrant further evaluation. Most of the fact I told you, no one has described scientific rationale. So we need more research, and we need more research to find out or implement dietary alteration for the management of these dermatological diseases, in addition to medications. Thank you very much.
Thank you, Himali, for the informative lecture. Time for the questions. Can I ask the first question?
Yes.
What is nightshade diet?
Sorry, madam.
What is nightshade diet?
I thought you will ask it and I remember, but I forgot now. I thought someone will ask, but I prepared this presentation within 2 days' time, unfortunately.
I was wondering whether it was some part of the bedroom furniture or...
No, madam. No, that's something contained food. Yeah, I will let you know, madam.
Thank you, Himali. Now, after a consultation, some of the patients ask, tell what not to eat
Yeah.
and what can be eaten.
Yes.
And most of these things that you mentioned
Yes.
are from the Western literature
Yeah.
and contains various vegetables, foodstuffs
Fruits.
which are consumed by mainly in the Western world.
Yes.
But I think what we should have is something which is suitable to our country. And it's very difficult to make a list
Yes.
according to, now say if it is psoriasis, it's different.
Yeah.
Now, things like dermatitis herpetiformis,
Yes.
there is a definite evidence
Yes.
about
That is
gluten.
the only dermatological disease that diet
Yes,
has definite
I remember,
role. Yeah.
I remember a patient after eating some biscuits, she got lot of lesions. So that is a definite evidence.
Yes.
But for these other things,
Yes.
it's very
Difficult, madam.
to make a list.
Yes.
But I don't know whether
From
there's
this list, we can
anything-
extract what we have also, madam. In this list, there are a lot of fruits and vegetables that contain in Sri Lanka also. And for the psoriasis, what they said, at first enrollment, ideally you should inquire about the patient's diet. That's what they recommend.
the red meat.
Yeah,
Red meat
means a
is
lot.
the thing that that's mentioned in the books.
Yeah.
But I wonder whether there is anything particularly in Indian literature, because their food patterns are somewhat similar.
Similar to us.
Yes.
What I
So
thought,
it may be worthwhile finding out whether there is a way of answering these questions.
definitely. Yes, madam.
What
That's
to
what
eat?
we don't have. Even literature also very limited, madam. The most are 70s, 80s and 90s studies, and some of the few studies conducted recently, that also with inconclusive evidence.
Yes.
And no, I couldn't find a study conducted in Asian. I think there were 1 or 2 studies from India,
Yes.
but none from Sri Lanka. So we have
So
to.
you are the ideal person to carry
May I
out.
suggest, Himali, that you make a small summary of this and maybe put on our website at least some more definitive food restrictions that we can
Okay,
recommend
madam.
as dermatologists, so that, it will be
Yeah. Okay, madam. I
good
will do
for
that.
us also to
Yes, I will
remember
do
and
that.
patients.
The other thing I wanted to tell is about vitamin D. Now, most of our people have vitamin D either at the borderline or at the lower level.
Yes, this is the upcoming trend, madam.
I'm
Most
yet
of
to find somebody with a good
Normal
vitamin D
level,
level.
you are right.
Yes.
So, whether these supplements, whether they are indicated and to which
Yeah.
diseases,
Yes.
when we look at dermatological diseases.
Yes,
So
madam. Because when I go through literature, I found that some of the conditions though you give supplement, that won't resolve the problem. But if you give same thing via whole foods, that will solve the problems. This also a hidden area which we have to uncover.
Yeah.
Yeah, same thing. Supplement won't do anything, but with the whole foods, that will do the job.
So there are many things to
Many
be
things that-
done about skin and diet.
Yes.
Hope it will be resolved in a meeting like this later.
Actually, madam, I did not have much time. I could have done better job than this, but I will do that, madam.
Yeah, just like cosmeceuticals, there is this term nutraceuticals nowadays in fashion. So that is again there are these supplements and the industry comes and tells us this as this as that. So we need to have some kind of an idea as to what is useful in what conditions. So maybe you can do a future lecture and educate us further on those as well.
Okay, madam. Thank you.
Thank you again, Himali, for the nice lecture. Please accept your